Yeah, thank you, ma'am.
Yeah,
Take care of your body is the only place you have to live in. The famous American entrepreneur Jim Rohn was definitely right when he made that statement. And this webinar will surely help all of us in taking care of us against the villain named COVID 19. A very good afternoon and a warm welcome to all. This is Mervyn Matthew, an MCOM student at the Oxford College of Business Management. Welcome you all for a virtual workshop on COVID-19 awareness, precautions, and preventions organized by the PG department of the Oxford College of Business Management. The Oxford College of Business Management,
I
under
think
the
some
aegis.
voice is hello.
Yes, ma'am.
Some some voice is repeating. I hope so. Echo.
No, ma'am, it's audible.
Is it okay?
It's fine, ma'am. It's audible.
Okay, then carry on.
Yeah. The Oxford College of Business Management, under the aegis of Children's Education Society, has transformed itself from the most humble blessings into one of the most vibrant groups in academics, sports, arts, culture, and discipline. The inspiration behind this is our founder chairman, Sri Narasa Raju Garu. The chairman of the Oxford Educational Institutions, Sri SNVL Narsimha Raju Garu, has been a constant source of inspiration and support for the faculty and students. I thank our chairman, sir, for giving us an opportunity for conducting this FDP. I would also like to extend a warm welcome to our respected director, Professor Dr. Jacob Alexander, who has been guiding us and inspiring us throughout this event. Furthermore, it is with special excitement that I am pleased to welcome our guest, Dr. Dinesh Sundaran, consultant incentivist, United Kingdom. Speaking of his introduction, he pursued his undergraduation in MBBS from Mysore University, had his postgraduate training in UK, and later he completed his FRCA and FFICM too. Currently, he is a consultant in anesthetics and intensive care medicine. Now over to you, sir. We look forward to the valuable information you're going to provide us. Thank you.
Thank you, Matthew, for that. Madam, are you okay if I start? Hello. Are you okay for me to start now?
You can start, sir.
Okay, sure. Thank you. So, as I was saying, I'll just do a basic presentation because there's loads of news out there on the social media and on the news. So I'm going to do some basic presentation about what you need to know about this virus, about the disease, and what we as general public we can do to stop preventing the spreading this, or at least to safeguard ourselves. Okay. Let me just quickly open my presentation. Are you able to see my screen now?
Yes, sir.
Yes, sir.
Visible.
Are you still able to see my screen?
Yes, sir, it's visible.
Okay, thank you. So, as we all know, this is a presentation about COVID-19. And so the first thing, what is this about? What is the disease as such? What is it caused by? As you may all know, it's caused by a virus. Disease can be caused by either a bacteria or virus or fungal infections. There are different types. So this is caused by a virus, and it is called SARS-CoV-2, as in because there was already another, and it belongs to the family called coronavirus. So the coronavirus, we already know in the medical field other diseases which have been caused by coronavirus. One is the SARS itself, which was caused some years back. And then there was a MERS, which was a similar respiratory problem, breathing disease, which came with breathing difficulties, and it affected mainly in the Middle East. Now, because there was already one similar one, we have called this as SARS-CoV-2. It came out first sometime around December 2019, when it was the first human case affected by this disease. And that was in Wuhan, as we all know, in China, where we think it was in the animal market. So it is already known to be in other animals. This was in bats, and from bats it is suspected that it came to human. It was an animal to human transmission somewhere in December in the Wuhan province. And slowly it spread to other parts of the world. And in March 2020, on the 11th of March to be specific, WHO, World Health Organization, declared it as a pandemic. Okay, I can see somebody's signature being there. Okay. Okay, now how does it spread? As I said, the first one was animal to human transmission, but later on it has been transmitted from humans to humans. So mainly it was travelers, as humans, when we travel to other parts of the world, it was spread to different countries. Now, most of them are infected because they were in close contact with the initial patient, and that's how we get it. And this can be either by direct contact or through droplets. These are the main things which play an important part. So this can happen when we produce these droplets, when we talk, cough, sneeze. And this is how most of the viral infections spread, as in the respiratory viruses. Be it the common cold we get, the flu, everything is spread in a similar fashion through droplets. So that's why hand hygiene and personal hygiene is quite important. Now, these droplets can enter your nose, eyes, or mouth, any mucous membrane through which it can enter. And that's how we get infected from another person. Also by direct contact, because these droplets not just enter us, it can be on the, say, you work in a place that can be a computer, your keyboard, and somebody else coughs and sneezes on it, and it can be there on it. And you go and touch it, and you're directly touching the droplets. And then from that, you touch your hands, or you use your hands to touch your nose or mouth, and that's how it spreads to you. The primary person who has transmitted the disease to you may be totally asymptomatic, so you may not even know from whom you got it, or they may be asymptomatic at the time that you met them. So these are the things which play an important role when it comes to government measures and policies which they have, which you'll be able to understand better. Now, if you see the epidemiology, at least more than 32.5 million have been affected worldwide. Not necessarily everyone has been hospitalized, but these are the number of tests which have been done and which have been confirmed, or at least due to the symptoms they have presented. And more than 16 million in our area of interest in America, more than 6.5 million in Southeast Asia, and majority have been from India. And Europe has got a major contribution to it. The main problem now is the second wave, which we're getting. India, in the contrary, is still going through the first wave. So it's a long storm, so you'll have to be ready for it. And The worst measure being deaths, that's been more than 1 million worldwide. Now, like I live in United Kingdom, as you all know. For us, the major brunt was from March to July, mid-July sort of a thing. So it was about 3.5, 4 months. End of March, so April, May, June, July was a main brunt that we took. But we had a later lockdown compared to when it started. And still we had to take the brunt for almost 3.5 months. But compared to India, the government did really well, bringing the lockdown quite early. I'm not going to say talk about the politics and the fashion about it, but so it helped to stop the initial spread. But if you think about it, UK is probably size of 2 states in southern India, and our population in India is about more than 1.3 billion. And as we all know, there was quite an uneven distribution of the socioeconomic status in our country as well. So not that the disease affects one economic state than the other, but then if you think the overcrowding, access to better health, all can be affected secondary to the socioeconomic state. Now, again, not following local measures which have been put in place. And that's not only in India, that's throughout the world. Even in UK, we have had that issue. In States, we have got that issue, people even going to court that not to have a mask on. So that's not something just in India. That's a human nature, I assume. So that's going to be there everywhere. Now, what can you present with? Actually, you may not have any symptoms at all, which is nice and well for yourself, but then there's always a risk of you transmitting to others. So there's always a chance of that. Now, mostly people come out with cough, and it is dry cough, not like when you get a common cold where you had a runny nose, you're bringing out any phlegm, nothing. It may be a dry cough. You may have a runny nose and you may bring out some phlegm later on. That's because you may get another infection on top of coronavirus itself. So if you have any symptoms, better to check it out. Fever, and you may have rigors with it. You may have difficulty in breathing. That means it has entered from your upper. So the cough and everything is because the virus is sitting in your throat and causing irritation, and that's the first cause of cough. But you can have a cough later on as well. But the difficulty in breathing is most likely there now that it has entered your lungs. It's started affecting your lungs. What we have seen throughout the world, I think the most important thing is, when you get a flu, you're quite run down for about a week or so. Fatigue, that's very prominent in this disease. We have had people who have left intensive care and have been totally fatigued for months. It takes to get back to anywhere near normal. As I said, sore throat. Loss of smell has been attributed to it, and it has one of the first few symptoms you may get it. So if you get that, then obviously you have to be even more careful, get the test done. These are problems from your breathing point of view. Now, you can have varied presentations as well, like they can come with stomach pain, they can have diarrhea. Diabetic patients may have problems with the blood glucose. And we found that it's not just diabetic patients, even a normal patient can come in with abnormal blood glucose level. So you have to be careful. People can have clots in their bloods. So that is one of the things which I realized halfway through when we started treating the patients, and then we have changed our treatment based on that. So there's always a risk of blood clots. So that's when you have to keep, even if you get the disease, try as much as possible to keep mobilizing yourself, moving around, doing some basic exercises, even if you're in bed. Stroke. We can have stroke where they can develop weakness, or some can be even more severe. Again, they can have chest pain, like heart attack. So these are other varied presentations. In children, it can present in even more with even more wider symptoms. Now, usually we start to present about 5 days after being exposed to the virus. But it can be at any time, even the day after we get exposed, we can get it, or it can be as long as 14 days. That's the most common. We have had presentations who have been beyond 14 days as well. So it's not necessarily 14, but this is the most common thing, between 1 to 14 days. And usually you're okay if it is after 14 days. But it's not the written rule. Most of them have a mild illness, so that's at least very good. Some of them don't have any symptoms at all. So it's good for that person who's infected, but there's always a risk of them transmitting to others because they don't know themselves that they have got the disease. For some, it can be quite severe. That's when they end up in intensive care, either to hospital or intensive care. And unfortunately for some, it can be fatal. Now, what can we do? This is the most important. So we know that the disease is out there. And obviously, there's no current treatment or vaccine as such. So the best way is to prevent it. And how do you prevent it? Is minimizing exposure to it. The golden rules now, as far as this virus is concerned, is wash your hands regularly, cover your face, make some space, that is, avoiding overcrowding and maintaining social distance. Obviously, if you have any symptoms, stay at home and try and self-isolate. Obviously, there will be local guidelines, either in your own towns, cities, states, or in the country. Kindly follow those local guidelines. It's difficult. They do keep changing, and that's not just in India, that's throughout the world, because it's new for everyone, and they're studying it every day. Now, as I said, minimizing exposure is the best way to prevent it. If you don't come in contact with the disease virus, then you don't get it. That's the idea behind it. So maintaining social distancing. Now, what is this 2 meters? Where does this come from? That is, when you cough, sneeze, or the droplets, most of them can reach up to 6 feet. That is about 1.8, 1.9 meters. So that's where the 2 meters. So if you're more than 2 meters apart, then the risk is much, much less. So that's why the advice is to be 2 meters apart. And if you're not able to, maintain at least a meter, 1 meter at least. And if it is, as I said, because the droplets cannot reach up to easily up to 2 meters in a normal state, so wear a face mask. Now, avoid large groups wherever it is. So no partying, no pubs, unfortunately. But that includes even hospitals. So even if someone close to you is affected, to not go and visit them unless it's really necessary. I think the rules are they're not allowing anyone to visit in as well in India, so which is kind of frustrating for a carer, or someone relative. But then that's what is actually needed both for yourself and for the patient. Obviously, work from home, that's a boon actually. We have come to know, minimizing pollution and everything. So wherever possible, work from home. Equally, avoid non-essential travel. Not traveling to work, but then traveling to visit your friend is not going to help, again, increasing your exposure. Again, as I said, it's difficult. I don't know about you guys, but it's sometimes quite difficult, especially in a hospital environment. It's not like we don't have a computer for each and every person. So we may have to share computers and keyboards. So you have to be careful when you're sharing the equipment. Make sure you wipe it clean before you start, and maintain as much as personal hygiene as possible. Plan your visits, minimizing your travel. So if you're going out either to work or to do some shopping, combine it. If you have to do some bank job, finish that at the same thing. Finish everything in one single travel if possible. So at least you go out once a week or something, but you do everything together. Don't go 4 times, once to get to the bank, once to buy some vegetables or missing something else. Make a list of what you need to do and plan it properly. Now, as you're saying, face masks. Now, why do we need the face masks? There have been a lot of hoo-ha about it, not wear face masks, especially in the US. I don't know about India, how much it has come through. But as I said, you have to understand the mode of spread. Exactly as I said, it is through droplets. Even when you talk, we can spread if I'm affected, I can spread it to you if I'm talking to you. And that's through the droplets, which I was saying. And these droplets hang in there, and it can enter your nose or any of the mucous membranes, mainly through the face. And when you get it, so it may sit in your throat, or it may even enter your lungs. So that's why social distancing, so minimizing the number of droplets you're exposed to, and obviously face masks. Again, as I said, by direct contact, when you're going to touch a contaminated object with your hands. So if you have touched something, wash your hands. And obviously, it's not possible every time to wash your hands, so use your hand sanitizer. Have a hand sanitizer in your pocket always. Use it whenever you think there's any risk. And if you have a mask, again, don't keep moving it, adjusting it, or removing it, because the whole idea is outside of the mask is quite likely contaminated. And by you doing all that, you're getting it on your hand. And the next thing, once your mask is moved, you will touch your face or you'll touch something else. So you're spreading it, not from yourself, but from the mask, from someone else. Now, there are loads of masks out there in the market. Now, we have disposable masks. So there, you would have seen a number of these N95 masks is similar. What we have, N95 is what is named in US based on that test. Similar to that, what we have in UK is FFP2 and FFP3 masks. They are the best at preventing the spread of these virus. So by basically the number says N95 is 95% efficiency in filtering the small particles. That not necessarily this virus, but that's what it is, the best thing which have been tested. And there is N100 as well, or which is similar to FFP3 in UK. And that's what we use in our hospital environment when we are treating these patients. But otherwise, it's not easy to get all these as well, and these are quite costly. So the cost-effective one where there's no availability of N95 or FFP2 or 3 masks, we use surgical masks. That is the next best option. But you have to be aware of something. Surgical masks are best if you have the virus and you're not spreading it to someone else. So if you cough it, it stops the virus in the mask itself and someone else doesn't get it. It is not the similar effect in preventing you getting a virus from someone else because the fitting is not as tight. But it does provide a reasonable degree of protection against the virus. So if you can get your hands on N95, that's fine. If you get your hands on, otherwise surgical masks are the next best option for anyone. And as I said, that's what we wear in the general corridors and everywhere in the hospital. N95 or FFP3, what we use in here in United Kingdom, FFP3 is mainly for treating patients in intensive care or certainly who have got the virus infection and we are treating them for that who are quite unwell. Now, obviously, these are not available for everyone. So what we have commonly used throughout the world, I think, cloth masks. Not as effective, but you can make them the best out of it. That is by getting it to be a tight fit. And obviously we can use, instead of a single layer, multiple layers of material. And cotton is supposed to be really good on that. And obviously wearing it in the correct position. There's no use if you're not covering your nose, just your mouth. So you have to cover your nose and your mouth. Now, because of social media and other things, you would have seen a lot of things about the risks of valve and non-valve masks. So basically, some of these masks have a valve on it, which is comfortable for the person who's wearing it because they can breathe out through the valve. But when they breathe in, it comes through the rest of other parts of the mask, and that's filtered. So it is, if I am wearing a valve mask, it is good for me because it is comfortable for me to breathe through it. But it doesn't protect someone else. When I breathe out, if I am an infected person, it doesn't filter out my breath. So the other person can get the disease from me, get the virus from me. So it is good if you are not infected and if you're wearing it to protect yourself. This is exactly the opposite of surgical masks, if you see what I mean. So you have to know the difference when you who is wearing it. So if you're going to visit someone who is infected, hopefully you don't do it. But then if you have to visit someone, and if they are wearing a valve mask, that is of no use to you. So you're at a higher risk of getting the disease. Instead, they might as well wear a surgical mask, and that way you are protected. I'm just going to show you a small video about face mask, how you can get it done at your own place. Are you still able to see the video? See my screen? Okay. I will answer all the questions towards the end, but if you want me to answer, I can do it now as well. I think Gayatri, someone wanted to. Do you want to ask a question now?
Sir, you can continue, sir. We can answer in the end, sir.
Sure, no problem. Still able to see my screen?
Yes, sir. Yes, yes, yes.
Yeah, okay.
Yes, sir.
Now, yeah. Now, the reason for me to put that video is because, as I said, the best thing you can get your hands on is a cloth mask which you can make at home itself. And if it is a multi-layered mask, it is reasonably effective. Now, they did a study to see which is best for small particles. That 1 micron, it's quite a small one, but that's what they could test against. Obviously, there are surgical masks, which is about 97. Then you see all the vacuum cleaner, dish towel, and everything. So the reason they mentioned about cotton, even though it's only 75% is just because it's much easier to breathe through as well. Because if you're going to wear a tight mask, you have to breathe through it. No use having all these effective ones, but if you're not able to wear it and then not being comfortable if you keep taking it off. So cotton is the best option. And there are even videos if you search online that how to wear just a t-shirt, cotton t-shirt, without you having to cut it as a mask. But remember, this will be a single layer. So you have to, best is if you can make a multi-layered mask. And the two important things are the outer layer, which doesn't say if someone coughs and the droplets lands on the mask, don't want that to be absorbed by a cloth and it coming into you. So you need a hydrophobic, which is it doesn't absorb water droplets. Now, where all you should wear? Any enclosed space, office, public transport, maybe go for shopping, If you have to go to hospital, certainly, because there's a very high chance you'll get it from the hospitals because people are the sickest you've gotten are in hospitals. As I said earlier, if you're not able to maintain social distance, if you're not able to maintain a 2 meter distance, then wear a mask. If you're coughing or sneezing, try to do it with, like, as in catch your cough within your elbow or use a mask or any tissues or anything. Just stop the droplet spreading anywhere else. And if you're caring for someone else, so you shouldn't get the virus from them as well. So wear a mask, even though they are at your own home, because you don't need a mask when you are within your household with your social bubble within your family. But if someone is unwell and you're taking care of them, not the best, but you need to wear your mask. It's better. If you haven't got it, then better not to get it, because at least you're there well enough to take care of them. There's no use you getting unwell as well. Obviously, if you are symptomatic because of COVID, it reduces the risk of spreading from you. Now, other thing is hand hygiene. Now, alcohol-based sanitizers are known to be very helpful in reducing the virus load. How much you need? Just a small amount, but you should make sure, even if you're using a alcohol gel, you can easily see where you have spread it and where you haven't. You can eat, so it should be enough to spread it throughout your hand. There shouldn't be any dry areas when areas where you haven't cleaned it with your alcohol gel. So small amount, but enough to spread it across both your hands. Have a pocket-sized one, either in your bag or in your pocket, and use, especially if you're going in public transport and stuff. Obviously, again, social media nowadays are quite helpful. They have shown a lot of images about how flammable it is. So be careful when you're using it. Don't take it anywhere near a fire. Even if you can't see it, it can be there and it can cause, it's highly flammable, so it can cause disasters. So be careful when you're using it around petrol stations, or don't bring it in kitchens. Be careful. Obviously, if you have applied it, and don't take it straight, because thinking if you're, I mean, you may use it because your eyes are itchy, you want to touch it. Before that, you want to use alcohol gel. Straight take your eyes, it will irritate a lot. So do not take it to any of your mucous membranes that is moist, like your nose, your eyes. It can be quite irritating. Obviously, do not drink it. It's very potent. It's got, for it to be effective, it has got to be about 60% alcohol in it. That's very high content. One, the taste is not good, and obviously it can be a health disaster. Even better than hand sanitizer alcohol gel is hand washing. I have put this video because, this poster, because it shows how well to wash your hands. We all can just put it in the water, make a couple of rubs, come out. That may not be as effective. You have to wash your hands for at least 30 seconds and look at what all areas you need to cover. So if you are going to do that, it will take 30 seconds at least. And that's the best effective way of washing your hands. Now, obviously, there are government measures everywhere throughout the world. Now they do the screening, and this can be quite intimidating or coming into a personal space. So screening, especially the contact tracing. Screening is helpful, one, for the surveillance of the disease itself, which helps in finding out how much it's spreading. So kindly, if you're asked to do a test, do it. Helps in knowing who is positive, and if you're negative, all the even more better. So at least you yourself can be, it'll be relieving for you. Isolation, again, that's very difficult. You'll have to, I think, especially when my friends have traveled to India, they have to stay in a hotel for 7 days and then go and self-isolate their home for 7 days. It's not easy, certainly not easy, but kindly try to adhere to it as much as possible. It's very important. It minimizes the spread. Contact tracing, again, I think there's loads of apps. And this is where I said about people being asymptomatic. You meet a friend who you don't, or you go to a place where you don't know if somebody is positive or not, but someone could have been positive there, and then you come home later, you come to know that you have been exposed to someone with a disease only because of contact tracing. At least for the next few months, try to help out with contact tracing. It will help you and everyone around you. Because if you're even if you're not symptomatic, if you've been exposed, at least you won't spread it to someone else in your own household. You can isolate, and at least even if we get it, we can avoid our kids or other family members getting the disease. Vaccination, well, that's what is we're all hoping will come and save us, come out of this lockdowns and pandemic. But it's not going to be now. It's going to be a few months before we can get anywhere near a vaccine, which is going to be proven effective, because it's all these are still in trial stages, and then it'll have to be tested on patients. And we wouldn't know, even if we provide some amount of immunity, how long that immunity will last. And by then the virus may actually mutate and may not be as effective. So we're all looking forward for a vaccine, but it's not going to be in the immediate future. So you're not looking at by 2020. Remember the lockdown measures. So every place they have been locked. You may say, okay, Sweden didn't do it, or some countries may not have done it, but then lockdown measures are mainly to minimize the spread. It's not going to stop the disease or cure it. It's only to minimize the spread. And that helps mainly the hospitals. If 100 people are coming in at the same time, it's not going, nobody is going to get the best care possible. There will not be probably 100 beds. I'm just saying it for an example. But if 10 coming, then later on 10 or 15, and then it's slowly coming in, by then probably the people will also have some amount of immunity based on the viral load in the community. Also, person affected will get a better care. But then they have to release a lockdown. I'm sure you have had multiple versions of the lockdown. That's because it affects the economy as well. So life has to go on. That's why the local guidelines and personal hygiene measures are there. Wearing the mask, personal hand hygiene and everything. And minimizing travel, work from home. All these are to help minimize the impact of the disease while trying to carry out as normal life possible. Now, a few facts. There are loads of facts out there, and it's very difficult to find out which is a fact and which is a rumor. Even for our medical fraternity, it is a problem. So it's very difficult when you're out in the community. Now, but the few facts which we certainly know are it affects all age groups. But the older the higher mortality is seen in adults, especially when they are old, more than 60 years plus. One, because the immunity may be affected, but then they've got other medical conditions, especially like diabetes, hypertension, high blood pressure. All these increases the risk, or even kidney problems. All these increases the risk. So as young people, you may not have the severity of the illness will not be as bad as the older generation, but then you may carry it to someone you love. So that's why it is important that you take care of yourself as well, not just because you'll be affected, but because there's a high chance as young people you will be asymptomatic, but you may pass it on to someone else who's higher risk of getting the disease and suffering from it. Now there was a big what can I say? It's a big hope on hydroxychloroquine that it will be very effective against COVID-19. Unfortunately, it didn't do anything at all. So I think, I don't know if it's still being prescribed, but last check a few weeks back, my friends were saying it's still being prescribed for people who, if there's any doubt of COVID, there is no proven benefit. And there can be serious side effects, especially with leading on to heart problems, if there's any underlying issues. So do not take it routinely. And as I said, most people have only got mild or moderate symptoms, fever, cough, or something like that. So in a way, that's better. But then some can be affected very seriously. Now, what we have seen in our second wave here is so far, pregnant people are getting infected now, are getting affected more. So the second wave is slightly different compared to the first wave for us. As I said, India is still in the first wave, and I don't know if you'll see a transition between the first and the second wave, or will it be continuous because it may spread to other states and come back. As I said, drinking alcohol does not protect you against COVID-19. So please do not try that as an excuse. Now, again, you would have seen this probably. A simple thing to remember: avoid touching your mouth, eyes, and nose wherever possible, minimizing the spread or getting infection. Follow washing your hands, obeying social distance, wearing a mask wherever applicable. There's no use wearing a mask when you're sitting in a car on your own. So again, think where you're going to wear it, or if you're exercising in open, say, park or something, as far as you're maintaining your social distance. So see where you have to use your mask. Exercise and eat well, and minimize any traveling as much as possible. Now, exercising and eating well, that is very important as well, because maintaining your health is very important. So keeping in good health, and that's not just physical, mental as well, because it's loads of stress. You may be working from home, and that's actually even more difficult. At least you go to the office, you finish your work, you come back, you're relaxed. That work is done. But when you're working from home, it's continuous, and you've got other things to take care when you're at home as well. So mental health is quite important. Take care of it, and that helps in the long run. Exercise regularly, because of physical state, if you get an infection, your physical fitness has a role in seeing how much you can, how, to an extent at least, how you recover and how fast you recover. Keep hydrated. Again, as part of your being in good physical health, avoid junk foods. Sleep well as well. Now, this I had to put because it's not just India. Even here, I've seen this. Now we have got to a stage when we think, okay, we are getting a hand over plastic waste and everything, but then now comes the masks. We see it everywhere being discarded after being used. That's actually even more dangerous, not just for spreading the disease, but as an environmental factor as well. So use your bin to dispose wherever possible. Like if you use it, sneeze into a tissue, dispose it in the bin. Do not just throw it away. Same goes with the masks. One, this can be taken by someone else. And even if they're cleaner, they're going to get it. I don't think I want to be the person who spread it to another person because of my carelessness. If you want, you can just take a cover with you, plastic, whatever, because you need something which is hydrophobic, which doesn't allow the droplets to come out. So that's why I said mention plastic here. So you can put your tissues there and that, and then you can, when you find a bin, you can discard it. Then you can come back and wash the plastic and use it again, a plastic cover, or you can bring it home and then discard it. And whenever you touch anything, wash your hands, which is the best option, or use your hand sanitizers. Obviously, some people have become famous in saying you can drink bleach or other disinfectants to get it. It's all effective only on the skin to prevent minimize the spread of disease. When you get it inside your body, it's harmful. So I'm sure you all know about it, but because it has been in the news, so I brought put it up as well. As I said, mental stress is very much a known factor, at least in the medical fraternity and even in people around here, because this has led to job losses. It has led to people having to put together at home for a longer time than they are used to. And there's obviously too much of information about this pandemic everywhere, every day in the news, social media. I stopped watching a lot of things about on the on TV and everything, because we will get to know from our medical, from our hospitals and from our from our journals and everything. But so see what is applicable to you. There's no use trying to see what's happening in in southern part of Africa or Europe. It will come in a long run, but it's not going to change what you have to do in your locality or your job at home. So don't stress too much about it. Follow your local guidelines. You get a basic understanding of the disease and how it poses a risk to you and those you care about. That's the main thing you have to know about it, and probably how it may change your job situation. If at all you're still worried, speak to someone. That helps a lot. And mental stress, whether you accept it or not, can bring you down physically as well. So concentrate on your mental health. And that's about it from my side, basically. I'm happy to take questions.
Sir, can I have questions, please? Yes. See, some of the participants, they have asked question. Ms. Seema Sharma, what precautions should a COVID survivor should take care, okay, to avoid reinfection?
Okay. Sorry, I'm just trying to bring the screen back.
Hello.
Sorry, I'm trying to get the Zoom thing back on, but okay. Ah, yeah. Okay.
Yes, sir.
Yeah. Yeah. Okay.
Yes.
So, what to avoid reinfection? What you have to do? Okay.
Yeah.
Uh,
What are the precautions for the survivor, COVID survivor, to avoid reinfection?
there is not many come back. I mean, at least fortunately, we haven't seen many coming back with a reinfection. But that doesn't mean that you won't get a reinfection. So main thing is the viral load itself. So if you have affected once, it is no guarantee as of yet thinking, okay, I've got the disease, so I can go and see someone else who's got a disease because I've already got an immunity to it. So minimizing your exposure further. Because if you have 10 viruses in your body, I'm just giving an example, okay, numbers wise, probably your body is still capable of fighting against it. But if you have if you get exposed and you get 100 more, your body may not be able to fight it. So minimizing exposure still holds as the role. And maintaining your own physical and mental health. Maintain your health, avoid further exposure. And I would say these are the main things to avoid a reinfection. And hopefully, if we get a vaccine, that will
Yes.
happen sometime in the future. But right now, there's nothing more. I mean, obviously, if you've got other comorbidities, like if you're a diabetic, keep your blood sugar in control. Keep all the other disease, chronic problems under control, and that will help as well.
Thank you, sir. The second question, Mrs. Tejal, only mask is sufficient while going outside. If no, then what other precautions should we take?
Yeah, as I said, masks itself, what kind of masks you're using. So that is good. Even with a mask, as I said, the mask is not the best fit. So try to maintain as much social distancing as possible. So avoiding crowded places. Obviously, it's difficult. If you have to go in a bus, you have to go in a bus. But otherwise, going to a pub is not the same as going in a bus for something which is necessary. And hand hygiene. Even if you wear a mask, if you're going to touch the mask and then move it and touch your face, is of no use. So just use your mask sensibly. And sometimes you can put your guard down, let your guard down because you've got the mask on. But that mask actually may prove to be the nightmare for you, because once you're in your own personal space, you remove the mask. But if you don't wash hands after that and you go to eat something, then you've taken it from the mask and put it in your mouth yourself. So social distancing, hand hygiene, and as I said, minimizing the exposure itself. The mask is the second step. The first thing is to minimize your exposure to it. Obviously, it's not possible always. So that's where the personal hygiene and face mask come in.
Okay, sir. Thank you, sir. So the next question, the same continuation, mask, sanitizer and social distancing. Apart from this thing, what are all the preventive measures for COVID-19?
Best is, as I said, vaccine. We don't have a hands-on
Yes.
on that yet. Um, Obviously, I think there are loads of stuff coming out in India about some medicines and liquid herbal medicines. I have no idea how effective these are. There's no test, nothing to prove whether they have been effective or not. So I can't say one way or other they are helpful in preventing, if that's what you're trying to hint towards. Here, we don't have anything else. And rest of the world, we are not following anything else apart from these three. So that they are the best things for now till we get a vaccine. And again, when we get a vaccine, I don't know when it will come, even when it comes, how effective it will be. Well, we have to wait and watch.
Yeah. Sir, one more question
Yeah.
along with this thing, Anil Kumar. Can any medicine be taken as paracetamol like that?
Yes. I mean, if you've got symptoms, fever, everything, you do take a paracetamol. Try to control your temperature because there's no use in suffering. Okay? Non-steroidals, group of drugs, what we call as non-steroidals, we have to be cautious about that. That's the main thing what you've said, especially if you've got other problems like kidney disease or diabetes and other things. It can make it worse. So certain drugs you can avoid. Initially, steroids were supposed to be part of things which were avoided, but it has been used in treatment, not the ones which are available in the market for your bodybuilding or the one which is used in medical treatment. So you have to be careful what steroids I'm talking about. So what if you have got symptoms, if you need a cough syrup to control your cough, that's fine. If you need paracetamol, use all that. That will help to control your symptoms, make you feel better, which is important. And only then you can eat and get better, you can mobilize. No use lying in bed and shivering, not taking paracetamol or controlling your symptoms. Get on top of your symptoms, drink enough water, eat well, keep moving. As I said, if you're dehydrated, if you're lying in bed, there's a risk of getting your blood clots. The risk is higher. So it's important that you mobilize as much as possible. Do breathing exercises. Again, that helps. Even when people are in intensive care or in hospital, we encourage them physiotherapy to help improve their breathing. Take in some nice deep breaths. Do your breathing exercises regularly. You've got yoga and other things which help. So if you know, continue with that. Um, as I said, when I said non-steroidals, it is Brufen, diclofenac, Voltron, or whatever. I don't know the brand names, Nurofen, all those things. They are the ones you have to be a bit more careful about.
Thank you, sir. One more question. Wearing of face shield without face mask. How can harmonize the two?
Okay. I wanted to mention about that. I missed it actually, but you brought it up. So there are respirators and there is the face shield alone. With just the face shield, I haven't seen anything with just the face shield, which is, I mean, you have to breathe through it. So if it is just a face shield without a mask, as if a respirator is there, that is with the face mask, that is like a gas mask, what you would have seen in movies of people working. And that comes with the face shield. That is effective because it protects your eyes, the rest of the face, and the what you're breathing through it, provided um, it is what do I certified for such use. Okay, so if it is that, that is very effective, even more effective than a normal face mask because gives a better fit and it avoids the rest. I mean, it protects your eyes and the rest of the face as well. The face shield as such without a respirator, one I haven't seen, but if with just a face shield, there should be a way through which you have to breathe through it, and that will not be filtered. So I don't think that is going to be effective. If you've got something which you've got a picture of, if you can post it, I will see whether that is of any good. And obviously, there are a few other things which I wanted to mention about masks. There are loads of masks out there in the society, like market. Even my parents have got one, and it says N95, but it doesn't even say whether it is reusable or not. So I like just be careful when you buy, whether it is certified and whether it mentions it's reusable or not. Because if you're going to buy a non-reusable mask and you're going to wash it and use it, it may not be as effective. Equally, if you get a reusable mask and if you're going to discard it every time, that's a waste of money and the mask because that is something which is meant to be reused.
Yes, thank you, sir. One more question. People, most of the people are asymptomatic. How to find asymptomatic person?
That's where screening comes into play.
No,
So
it's ordinary people. When we across, okay, we come
yeah,
across in the thing. How
yeah.
to find it? Yes, sir. Thanks.
So that's what. So it's very difficult. Um, that's where the mask help. It is not easy to find when people are asymptomatic, and even if they become symptomatic, say as I said, it comes only after 5 days. They may get the symptoms. So we may meet them in day 3 or day 4 or few days before they become symptomatic, and we may still get the virus. So it's very difficult to find the persons who are asymptomatic. So two things which help is screening. So like in UK, I don't know how it was set up in India. I wanted to check with someone, but I couldn't get much of a response. I apologize for that. But then what we follow here is every week, especially us in the healthcare, we are being asked to check whether we are positive or not. I think even in India, we follow everywhere wherever they go. We check the temperature because they may be asymptomatic, but they may have a temperature alone, which even they may not realize. So that's the first thing. So screening is helpful. So if you get a letter asking you to test, go for a test. It's nothing, if not for anything else, it will give you a reassurance that it is we haven't been affected. And again, I love to mention it. The tests are not 100%, okay? But that's the best we have got. So we have to go with what we have. So testing is one. And that's when contact tracing. So you may not realize the other person is symptomatic or you've got the disease. But then by the time they get symptomatic, the only way you can know is through contact tracing. So the government, I don't know how it works still again in India. So here, if you go to a restaurant, they'll ask us to scan the app and to know that we have been in that restaurant. And if it's a closed restaurant and if someone else is affected and they would have been asymptomatic at that time and they get admitted to a hospital or something, they become positive. Through the contact tracing, they let us know, look, you have been exposed to this area where there was symptomatic, where there was a person who was affected. So take care, isolate, do what you have to do. So that's where, as I said, maybe hinging on our personal space and our privacy, but you need to do that. That's the only way to minimize it.
Thank you, sir. Is there any diagnostic test to know the chances of reinfection, COVID reinfection?
Yep, that's the only way we do it. So we do send some swabs, so either from the throat or the sputum, to see if the person is affected or not. So we do. It's a RNA virus, so they do check the presence of the virus itself. They're able to, and there are loads of tests. So I think it's the number of tests that we can do is limited, but then certainly on a particular day, because of the test kits, but there are tests out there which can test directly. So the virus, obviously we won't have it. It'll be the labs. We send a sample and we can check the virus itself. But as I said, if it's positive, it's certainly positive. If it's negative, I can't put a percentage, but it's quite likely it's negative. But we do say, okay, especially in the hospital places, we wait for another sample just to make sure they are negative till we are sure. But if you're asymptomatic and the test comes back as negative, you might as well take it as a negative.
Yes. So next question. What precautions should be taken by the elderly people to protect themselves against COVID-19? Apart from normal these things, elderly
Yeah.
people, any special precautions?
Main issue with the elderly people is they've got other diseases as well, other problems like be it high blood pressure, glucose problems, kidney problems. So the main thing is to get all these under control. If you should, because if you get all these under control, their risks are almost not the same, but then almost coming back to how the similar to us. So it is important that they get all the other problems, the chronic problems under control. So if you're a diabetic, if it's going out of control, speak to your doctors, get your diet in control, get your blood glucose in control, get your blood pressure in control. And especially if you're on medications, which is going to affect your immunity, like people have arthritis and there are medicines to keep their immunity because it can be secondary to their immune response itself. Some are on medications to keep their immunity under control, and that poses them at a higher risk. So they have to be certainly self-isolated. There's no other best ways to avoid being exposed to this, because once they get the disease, the chances of them going quite poorly is very high. So that's why we say keep the other what we call as comorbidities, other diseases which are chronic disease under control. Get your weight under control. That is not just for everyone. Get your weight under control. Quit smoking because this is affecting your lungs, and your smoking will also affect your lungs, and it increases the risk because on a damaged one, the virus can make it even worse when you get an infection, chest infection. Quit smoking. All these extra measures. Alcohol, again, I know you asked especially about elders, but this is applicable to everyone. So keep it, yeah.
Yeah, next. So the present pandemic period, most of the people are staying at home. How to boost the immunity in staying home? By staying home, how to boost the immunity?
Yeah, okay. I think there's nothing proven to as such boost your immunity. As I said, staying healthy itself is good immunity. Well, you can take your vitamin tablets and other things if your diet is not good, but a healthy diet, sleeping well, and exercising regularly, including your breathing exercises, that will keep your immunity at optimal level. That's all you need. You don't have to do anything extra on a regular basis. Boost your immunity as such. You can take vitamin tablets and supplements and other things, but main thing is eating a healthy diet, a balanced diet, having a sleep and getting some proper sleep rest, and um, physical fitness, exercising regularly. I know it's difficult even at home, it may be, but you may be able to go to the park. Choose a time when it's going to be less crowded. If you have to go to the park to do some exercise and other things. But again, when you go to the park to do the exercises, try not to use the shared equipment. Go for a jog, run, that's fine. But try not to use the equipment over there wherever possible. But if that's your way of doing it, well, do it, but then maintain personal hygiene, have your hand sanitizers, use that.
Yes, sir. Sir, add on to this, what basis we can take vitamin tablets only by when suggested by physician?
Sorry, can you repeat that, please?
So what basis we can take vitamin tablets?
As I said,
Only when suggested by physician, or we can take on ourselves.
there's no
Vitamin
proven
tablets.
benefit either way. So it's entirely up to the. I mean, I think we have a higher uh, prescription rate for vitamins in India, anyways. So I'll leave it to you. I don't have anything specific about. As I said, these are just a supplement, and there's no proven benefit. If you're having a healthy diet, then it's fine. If there's other indication, if you've got a blood test to prove that you've got low vitamins, you've got anemia secondary to it, or got low iron, obviously, yes, you need to take it. That's a different one. But on person who is having a healthy, balanced diet, who doesn't have any problems, you don't necessarily have to take it. If you have to take it, just like that, there are loads of things are available from the market. You don't necessarily need a prescription, but obviously you can discuss with the doctor there.
So one more thing. Is it safe to donate blood during the pandemic period? Now,
Yes, certainly.
certainly.
Yeah.
Thank you.
Obviously, hopefully, they'll check everything for your. They'll get your history as well about travel history. That is all should be all in place already. That's not going to change your travel history. You're being well in the last few months. All that things shouldn't have changed. And if that's the criteria, then you should be able to relate that. Good. Glad you're thinking about positive things even in this pandemic.
Any other questions? So this much questions I have seen in the chat
Yeah,
box.
sure.
One more question. Is there any special care to be taken for cardiac patients as well as this diabetic patient?
Uh,
Cardio patients and the
no, there's
diabetic
nothing
patients?
special medication to take, but you may have to be careful about certain medications which you already take. So you can discuss with the doctor and see, especially when you're on. Um, Make sure your obviously your heart problems and your diabetes is under control. But if, and the tablets you take can affect your kidneys as well. So there's one particular set of drugs which have been in and out of news saying first they said it's not safe to take, then they said doesn't prove anything. So there's still loads of debate about it. But as of now, there's nothing you have to take, but you have to be careful about what medications you take. So you may want to discuss with your doctor about what medications you're taking and make sure they're happy with everything. You may have to do a blood test to check your kidney function, your blood sugars, everything. But do all that and revise your medications with your doctor who has been taking care of you all this time. I'm sure they'll be able to throw some light on it. So there's nothing special you have to take, but you may have to avoid certain drugs. But if you have been fine and if you're still fine, they may say just continue with it.
Yes. Uh, is
And
there any
sorry,
other
along the
question?
same lines,
Yes.
if you get infected, just discuss again that the doctor may say, oh, you're okay to take all these medications when you're well. But if you get infected, if you're self-isolating, if you're feeling unwell, you may have to repeat the test and you may have to revisit your doctor. I mean, not visit him, as in speak to the doctor again to see whether any medications need to be changed. So when you're well, it's different. When you get unwell, sick from COVID, then it may be different. So just because they have said it's okay 2 weeks back, but now you're unwell, just speak to your doctor again, check if you need to do a blood test, see if they are still happy about the medications you take. So there may be changes based on how you are and what blood test is showing. Yeah.
Yeah, next question, sir. Patients recovering after getting immunity, but there are cases of reinfection. What is the chance of recovered patient getting COVID again? And what is the role of immunity in protecting ourselves?
It's, as I said, it's a new disease. We we were hoping there won't be a reinfection, but there have been cases of reinfection. But fortunately, the numbers are so low, I can't give you a number now. Very less. You may get another infection on top of COVID, a bacterial infection or something else, but not. I there's we don't have enough numbers to say this is the percentage of reinfection rate. Unfortunately, I'm sorry, I'm not able to give you advice because, as I said, the second wave is just coming in. We have, at least in our hospital in our region here, we haven't had any readmissions and secondary to COVID itself. They have come in with other problems, but not as a plain reinfection to COVID. There have been sporadic cases here and there, but fortunately, that's not been the main case anywhere else. And about the role of immunity, it's the same. I think because once you have infected, as I said, it takes a longer time. to get your strength back, to get you anywhere back to normal, including your diet, your mobility, everything. And those are important things to get back to normal and get a better health. So I'll say continue working on it. And specific role of immunity, there's no studies or anything that I can say.
Thank you, sir. Mr. Vinay will take over the vote of thanks.
Thank you, ma'am. Is my voice audible, ma'am?
Yeah, it's audible. You can go
Yeah.
ahead.
Hi all, namaste. Good afternoon, respected speaker, sir, my dear teachers and my beloved friends. Myself, Vinay N from the Oxford College of Business Management. Today, at this special moment, I take a privilege to propose the vote of thanks. Today, my words are not enough to express my gratitude. I would like to thank our beloved speaker, sir, Dr. Dinesh Sundaran. Sir, thank you so much for all the words. It was very informative, and we will ever remain grateful to you, sir. And we thank you so much for being with us today. And heartfelt thanks goes out to all our faculties, teachers, and students from various colleges and universities for making this event successful, without whom the event wouldn't be successful. We feel proud, and thank you once again, sir, for giving us such an information. Once again, thank you all. Stay home, stay safe.
Yes,
Thank
sir.
you, everybody. Hopefully you
Yeah.
found it useful. Thank you, madam.
Thank you, Dinesh sir. Thank you very much for your outstanding presentation today on COVID-19 awareness, precautions, and preventions. Thank you, sir. Thank you for your valuable time spent for us. Thank you very much.
Thank you. Bye-bye.
Thank you. Kindly fill the feedback, all of you. Thank you, sir. Thank you very much. Sir, you can end up your meeting, sir.
Thank you.
Thank you.
Bye-bye.
Bye.
Ma'am,
Yes, Vinay.
session was very informative, ma'am.
Oh,
It
thank you.
was
Good.
good.
So, shall we wind up?
Yes, ma'am.
Yeah, kindly fill the feedback form. Okay, if you have any problem in the feedback form, ask in the group, we can rectify it. Thank you. Thank you, one and
When will you
all.
be getting the e-certificate?
Yeah, you will get it. You will get it.
Where will you be getting?
No, immediately you will get it. Otherwise, within one day, you will get it. In case if it's more, you will get it. Thank you.